Patient is a 61-year-old male who presents to the ED for evaluation of a motor vehicle collision. Patient reports he was driving on Lyons Avenue when a car behind him spun out of control and hit his car. He was wearing a seatbelt and there was no airbag deployment. Patient notes he filed a police report and did not seek medical attention as he felt fine at the time. Today, patient complains of right-sided neck pain and back pain. Of note, patient took a leave at 9:30 this morning, which did not help, prompting ED visit. Otherwise, no head trauma, no LOC, no blunt trauma to trunk, no headache, no chest pain, no abdominal pain, no extremity pain, no numbness, no muscle weakness, no incontinence. Review of systems is all negative, so you can keep that as is. The patient's past medical history is unremarkable. Social history and family history are also unremarkable, and we do not have any medications or allergies listed for this patient, so you can leave that blank. As far as his physical exam is concerned, patient is alert, awake, and in mild distress. For his exam, you can put for his neck, minimal right paracervical tenderness, but there's no midline tenderness, no crepitus, and no step-off. For his back, you can put positive lumbar paravertebral tenderness. Otherwise, his distal pulses are intact, and his exam and neurologic exam is otherwise unremarkable. Make sure there's a full neuro exam in for him. His GCS is 15. Diagnostics. Pulse oximetry is 100% on room air, indicating adequate oxygenation. We performed an X-ray of the lumbar spine, which is negative for fracture, negative dislocation, and positive straightening consistent with spasms, as interpreted by me. We also obtained an X-ray of his cervical spine, which is positive for osteophytic changes, no fracture, no dislocation, as interpreted by me. For the ED course, patient's condition remained stable during the ED evaluation. Previous medical records were requested and not found in Cerner. Orders written. X-ray of lumbar spine and X-ray of cervical spine ordered. Patient was treated with the J&J COVID-19 vaccine IM. Diagnostics reviewed and discussed with patient. On reevaluation, patient appears to be resting comfortably, in no acute distress, and he is safe for discharge home. Vital signs are stable. No further workup or treatment indicated at this time. He was advised to return to the ED with any worsening symptoms, and I stressed the need for outpatient follow-up. RX written for Flexeril, PO. My clinical impression for him is MVC and musculoskeletal pain. He's being discharged home. Follow-up to be arranged with Dr. Sun in 2 days for further evaluation. As I said above, patient was instructed to return to the ED for any worsening symptoms or other concerns. And these instructions were given to the patient, who was given the opportunity to ask questions and verbalized understanding. Thank you, and please don't forget to put in your scribe macro at the bottom.